Since 1994, Rwanda has made progress in reducing extreme poverty. Healthcare has gotten special attention.
After the genocide, this tiny, crowded country, one of the world's poorest, was written off, including in one prominent medical journal, says Health Minister Dr. Agnes Binagwaho.
Just after the genocide, there was an article published in The Lancet saying Rwanda is a land of desolation. Don't invest there.
Dr. Peter Droback heads its Rwanda office.
One of the things that I see Rwanda having done very effectively is really take ownership for its own development activities. What happens all too often in poor countries is that the agenda is driven by the donors or by the development agencies.
We should demystify care providing, the way we provide care, and we should empower the community to be in charge.
Dr. Agnes Binagwaho led the incredible turnaround of Rwanda's healthcare system. She's now Vice Chancellor of a new university in Rwanda dedicated to improving healthcare in the world's poorest communities.
What has happened in Rwanda over the last 20 years? It's everything except a miracle. It's hard work of thousands and thousands of health professionals, of caregivers, and of people who have thought all along those years, how can I do better today than yesterday? We have found how to move Rwandan together. And I love the international assessment who say the best place to be born a girl in Africa is in Rwanda. By creating a health sector targeting the most vulnerable and focus on decreasing gender disparities, we have rebuilt trust, and it makes people willing to care for themselves and to support a system that wants to care for them. Everything that Rwanda have done is in a way or another replicable.
Where rather than all of the aid going through non-governmental subcontractors, nonprofits and for-profits that take 30, 40, 50% of the overhead and then implement programs, the money's going directly to the government.
Has a severe shortage of doctors. There's one for every 100,000 people. The comparable figure in the US is 273. So there's a concerted effort to train other health providers.
The University of Global Health Equity is a new university in Rwanda focused on the delivery of care to those who need it most. In 2015, Partners in Health took the first steps in realizing a long-sought aspiration to create a university that would advance the science of healthcare delivery, an institution that would expand the traditional paradigm of health sciences education by rethinking every aspect of a university, from the content of its curriculum to its research priorities, to the location and design of its campus.
On March 8th, an Indian national traveled from Mumbai, India, to Kigali, the capital of Rwanda. 5 days later, he called the country's COVID-19 hotline after he began experiencing flu-like symptoms while at home. He was subsequently referred to a hospital in Kigali. On March 14th, the Rwandan Ministry of Health confirmed what many feared, the country's first COVID-19 case. The Rwandan government was already on standby to kickstart its COVID-19 strategy after closely observing how the disease was spreading in Asia and Europe. Its president.
At the beginning, we decided to lock down the city, to shut down borders, to stop movement between Rwanda and neighboring countries.
We came from 26 years ago from a genocide against the Tutsi in Rwanda that took out of the health system 80% of the health personnel capacity were either killed, either participated in the killing, or just doctors, nurses, and health personnel just become themselves patients in need of care. You could imagine that with a COVID pandemic coming in, as we build the system, would cause more harm and destruction of the system that was already at a stage of reconstruction. The best economy you can imagine is when people are healthy. When you do proper lockdown, you are indirectly investing in the economy.
1 year ago, we had Ebola outbreak in our regions in ways that has helped us also to prepare indirectly to COVID response by putting in place response teams, treatment areas. So when it happened, we had to deploy our teams. We were just ready.
Also reminded to practice good hygiene, while hand-washing stations were created around the country. The Rwandan government gathered around 2,000 frontline workers and contact tracers, including medical students and police officers, to meet the challenge.
The decision to use other people who could do the same job as doctors and nurses could be doing was not only to maintain the continuity of services in hospitals, but also was to upgrade and to give skills to people who would going to use this same skills in the future.
Follow them up on a daily basis to see if they have any symptoms, if they have developed any. We refer them and connect them to our rapid response team for evacuation and taking them to different facilities for a closer follow-up.
Hello, I want to take your temperature. Uburyo ya risk yo kongera kwandura ku muntu wamaze imbere y'umurwayi bayiyonse. Iyo rero hagize igihe kinini robot nazo zimaramo umuganga akaba ari hanze bituma bwa buryo bwo kwandura umuganga bugabanuka.
At the start of the pandemic, the country was testing close to 1,000 samples a day, but a pivot to the pool testing approach increased its testing capability 15-fold. This strategy has also been successfully adopted in other African countries, like Ghana, and was launched in the United States in July.
Health workers randomly screen and test drivers as they enter Rwanda's capital, Kigali. Motorcycle taxi drivers carry dozens of people daily. Their risk of infection is higher, so their temperatures need to be checked.
All this is trying to know what's going on in our population, who has the virus, who could be asymptomatic and we haven't noticed, and generally just having a picture of how coronavirus is affecting our population.
Jean-Luc Habimana, a documentary photographer and Kigali resident, remembers the panic he felt when the country confirmed the first few cases of COVID-19.
The first days were a bit challenging because, you not need to stay home all day long. More real, it felt. Because before it'd be like, oh, people were like, it's happening in China, maybe it's, But then when it was in Rwanda, they were like, oh, the first case was reported. Like, oh, this thing is real, this thing is serious. They had started following the measures against COVID way before the first case was recorded. So we're like, oh, pretty sure things are gonna get controlled and stuff. But then of course cases kept coming.
Most important success in COVID response in Rwanda is having a health system that is ready to accommodate any pressure.
The pandemic is still there, so we are still reinforcing our capacity for testing. We are still reinforcing our capacity for engaging our population.
And whenever you have a pandemic, everyone is concerned, everyone plays a role.
Security forces are making sure people follow lockdown orders in the capital, Kigali. Anyone who doesn't can be arrested and fined. Those with valid reasons, such as visiting a hospital and market runs for food, have their temperatures checked before being allowed to proceed. At the start of the lockdown, police shot dead 2 people. They said the men attacked a police officer. Soldiers have also been accused by several slum dwellers of human rights abuses, including rape. Security forces in several other countries on the continent, such as Kenya, South Africa, and Uganda, have also been accused by human rights groups of using excessive force on civilians while enforcing government restrictions.
In July, the European Union lifted travel restrictions for Rwandan residents, a testament to the country's overall response to contain the pandemic.
Tested positive, and literally the government showed up at my place and came and dragged me away from everybody I was with, and I don't speak the language, and they came and locked me in this room, and I can't leave, and it's really scary. I don't know why I have it again, and I'm not with anybody that I know, and I've been from to Africa, and I don't know how long I'm going to be here, and they won't tell me anything, so.
Then on the vaccines issue, there was, I think, a comment last week from some couple of scientists who said the testing ground for the new vaccines will be Africa. To be honest, I was so appalled, and it was a time when I said, when we needed solidarity, this kind of racist remarks actually would not help. It goes against the solidarity. Africa cannot and will not be a testing ground for any vaccine. We will follow all the rules to test any vaccine or therapeutics all over the world using exactly the same rule. Whether it's in Europe, Africa, or wherever, we will use the same protocol, and if there is a need to be tested elsewhere, to treat human beings the same way, equally. And the hangover from a colonial mentality has to stop. And WHO will not allow this to happen. And it was a disgrace, actually, and appalling to hear during the 21st century from scientists that kind of remark. And we condemn this with the strongest terms possible. But we assure you that this will not happen in Africa and will not happen elsewhere in any country. Proper protocols will be followed, and human beings will be treated as human beings, because we are all human beings.